we're now providing a new service at the hospital. Patients coming to our ambulatory care, fracture clinics, pre-surgery clinic, and outpatient rehabilitation will now register at a central patient registration before going to their clinic appointment. President and CEO Michelle D'Emmanuel was on hand for the official opening.
Welcome to Credit Valley Hospital. I'm very excited today because today is the opening of one of our first new registration areas. Our new registration desk will see almost 1,300 patients coming through the doors. In the coming weeks and months ahead, we'll begin constructing the second registration area, which will be in our lobby. We're excited because in working with you, we know that we're making healthcare better from the moment you come through our doors.
Well, many hospitals at this time are adopting a central registration model because it enhances the quality of the data that we get through registration, and this data is used in many functions in the hospital, from health records right up to quality and decision making. In the past, registration was done by 200 registration personnel and at 56 sites, and so that provided a lot of variability in the data that we were collecting, and this needed to be corrected. So with the new site, we're going to have registration specialists who their entire job and performance is measured on the job that they do at collecting the registration information that needs to be taken. The patients, when they come into the hospital now, will need to come down to the registration center to register before they go to the department where they're going to have their clinic visit or their therapy. We are gradually implementing the departments. Initially, we are doing ambulatory care and fracture clinic, and later on we will add pre-surgery clinic, outpatient rehabilitation, and PRCC. So with a gradual implementation plan, we will take in most of the services that are found in the Cancer Center building. When the patient comes to the hospital, they should always bring their health card. The health card is like going to a store with a credit card. You need to access the health service, you need to have your health card so that we make sure that we pull up the right patient, and therefore the right patient is getting the right treatment. So you should always bring your health card. If you happen to have a green card or a red and white card that doesn't have your picture on it, you should also bring picture ID so that we can make sure you are the person that's supposed to be coming to us for this particular appointment and that we're registering the right person. One of the changes with central registration is that what you're used to doing is going to ambulatory care, for example. In ambulatory care, you registered, they put your chart together, you went and saw the physician, then you came back to the same desk and they booked you for your appointment. With the new centralization registration, that process changes a little bit. You will come to the central registration desk to register for the appointment, then you will go up. You will drop your notification tag off at the desk, and you will see the doctor, and you will book your appointment upstairs. And so registration is not the booking of appointments, it's the registration of your demographic data so that we know we have it in the system accurately and get you ready to have your therapy or your doctor appointment that you're going to have that day. So this registration center is the first of 4 registration centers. This center opens today. The other 2 registration centers are currently open. It is ER registration and the diagnostic imaging registration. In March of 2012, we will open the 4th and final registration center, and this is up in the inpatient lobby. The vision is that no matter what door you come into the hospital, you will be able to register for your appointment. So it doesn't matter if you're going to a department that's farther down at the very end of the hospital in the new A&H wing, you can register at any door that you come in. And so it makes for a much more patient-centered model in terms of arriving for your appointment, knowing where you're going, and getting directions in a very speedy fashion once you come in the door.